back. This is Reside the Real Estate, brought to you by Health Sense TV Africa. Today we are talking about an interesting topic: housing and health, the relationship and the correlation. I am not here alone. I'm here with a guest, Dr. Terfa Kene. He is the President, Association of Public Health Physicians of Nigeria. You're welcome, sir.
Thank you very much. Thank you, audience. Good morning.
Yeah, you're welcome. So, lately, housing has been on demand. And a lot of people tend to not to get the information, the right information about housing, and not to talk more of the relationship between housing and health, the importance, the livelihood and all that. We would like to know the relationship between housing and health. Like, what's the correlation between it?
Thank you very much. Thank you, Abuja residents, developers, residents of estates, and everyone in Abuja. My name is Dr. Terfa Kene. I am a consultant public health physician, epidemiologist, and medical statistician. I'm currently the President, Association of Public Health Physicians of Nigeria. Housing and health are twins because housing is a critical determinant of health. In fact, it's a social determinant of health. One, when we talk about housing in certain categories, talk about slums and, of course, the standard housing. But what we're seeing in Abuja is that we're moving from slums, overcrowded slums, to overcrowded duplexes.
Wow.
And all these have impact on the health of individuals. Now, what are we talking about here? First, let's look at the direct impact. Now, when there is substandard use of materials for building and a disaster, what happened? People sustain injuries.
Of course.
And those injuries are health-related. Imagine someone's father died because a building collapsed on that person. The life of that child never remains the same again, with respect to mental health. Now we know that. Now we also talk about housing affordability. Now, once an individual is paying more than 30% of his monthly income into financing housing, it becomes a problem because other aspects of life are affected. So, for instance, if your annual income, you are spending more than 30% of that annual income to acquire housing, it means that the school fees will suffer, feeding will suffer, other aspects of individual. So housing should also be affordable. These are some of the things that comes with it directly relating to health. Of course, the standard quality of materials used, I've talked about it with respect to safety, talk about affordability. But there are other aspects of it that are indirect. Now, let's look at it. I've just mentioned that we're moving from overcrowded slums to overcrowded duplexes. What happens to ventilation? Now, once there's a duplex in front of the other one, cross ventilation is not achieved, even though you have windows. And the impact can be around asthma, respiratory tract infections, and other things. Of course, overcrowding itself comes with its own problem. What are the indirect things that we may even talk about with housing? Now, we know that if there's no space, nobody can now come out of the building for any reason. So, space in a compound allow people to freely mingle among themselves. But one indirect effect that happens is that if there's no space, you can't come out to even experience the natural environment with respect to sunshine and others.
So thank you for that beautiful answer. So the problem is that a lot of people are actually aware, but they don't want to give in to this, especially, let's say, the people building the houses. They are doing this for certain reasons, which is economic related. So I would like you to broaden on that aspect so that our viewers can be aware and educated, enlightened on this particular aspect.
I agree that people who do business should make profit, no doubt about it.
Of course.
But housing affects everybody. Because one, if for instance you develop housing that is appropriate, people are happy with you and they will pay more for it. If you go to a place where there is space and there is sufficient space for family to mingle, the fact that they are happy makes them want to have better relationship among the neighbors.
Yeah, true.
So, of course, we are seeing estates where there's no playground, there's nowhere to people to go have
to relax.
There's no, even some places there's even no places
no space for ventilation.
Not just ventilation. Beyond ventilation, you have even no markets or things that people can take advantage of. Now, let me also talk about things that you may not understand.
Okay.
The sun is important to us, right?
Of course.
God created the sun. Now, what happens is that if there is no space for families, indirectly, certain things happen. One is the fact that they don't come out. So because they're not out, they cannot get exposed to the sun.
So
I know that the sun is responsible for 95% production of vitamin D in the individual. Now, once they are not, the entire family is not being exposed to the sun, they're not producing vitamin D. Now, because they're not producing vitamin D, they deficient of vitamin D, and these have all manner of health-related issues. Vitamin D deficiency has a relationship to cardiovascular health. It has relationship to reproductive health, sexual health. It has a relationship even to mental health. You have children who are getting depressed just because they have no vitamin D, and we are seeing that happen in this Abuja.
Wow. That's, it's a very beautiful one, and it's quite enlightening because a lot of people they know all this, right? But they are just focused on their income, their own area of interest. That is, what I mean by that is that their own personal, that's where the money is coming out from and how they will gain at the end of the day. So it's quite unfortunate that it's still happening, and in fact it's growing by day, and it's really alarming. So talking about that, what advice do you have for the government and the estate developers concerning this issue?
First, there should be policy change.
Okay.
There is policy change around housing.
What do you mean by policy change?
Okay, fine. One, looking at the standard and quality of materials that are being used in some of these estates.
Okay.
If you go out there, there are some estates that the blocks materials used are substandard, and of course the risk is there. When you use blocks that can create mods, that can have effect in terms of children. Of course, even painting. People are using lead painting. Wow. Now, when you use lead to paint a house, the risk of lead poisoning is there because children who are young may actually touch the wall of the building and things like that. Of course. So some of these standards should be set by government and ensure that there is actually compliance. Again, is that we must talk about space, sufficient space for human interaction in every estate. Now, this is important. Now, it affects mental health. I just mentioned to you that if you are not getting exposed to vitamin D, to the sun, you don't produce vitamin D. Now, we are having housing pattern in Abuja here that entire day someone stays indoors. An entire day. There is no reason. If your child is out, the chances are that, you come and say, come in. In the course of coming in, you have made some steps, you moved, you are there in the sun for some minutes. But here we are now, throughout
from morning
the whole
to night.
If you do that for 1 year, your child will be vitamin D deficient, you yourself will be vitamin D deficient, your spouse or every other person that have that similar behavior. So there should be space enough for families to interact. Very important. While people are looking at profitability, we should also look at long-term impact on the life of families.
Yeah. Thank you so much. We would like to go on a short break. Please stay with us.
From the capital city of Nigeria to homes across the continent, one station stands tall as the voice of Africa's housing industry. This is Housing TV Africa, the home of credible news, powerful stories, and the latest in property and construction. With world-class studios, cutting-edge technology, and a team of trusted professionals, we deliver excellence in every broadcast, connecting investors, developers, and homeowners, building trust and creating value for your time and money. Join the movement. Partner with a brand that defines credibility in housing media. Housing TV Africa, your housing dreams come true. Watch Housing TV Africa, your gateway to Africa's housing and construction world.
You're welcome back. In case if you're just tuning in, this is Inside the Real Estate on Housing TV. I am your host, Hafsat Ibrahim, and I'm not here alone. I am with Dr. Terfa Kene, who is the President Association of Public Health Physicians of Nigeria. So before we went on the short break, we talked at length about housing and health, the relationship, the correlation, and possible solutions. And he also, by extension, gave advice on the solution of how to curb all this housing challenges and the health impact. So going forward, sir, we would like to ask you another question which is related to this. So a lot of estate developers, right, they are just they are aware of all this, right, but they are just focused on their own income, their own personal income, what they have to gain at the end of the day. They don't really care, even if, for instance, like the government raised this alarm or personal experience of other people, they'll feel like it doesn't really concern them. That's not their own cup of problem. It's the cup of tea of every other person, because they are focused on the financial aspect and their pocket. So how do you communicate in a matured manner and based on your own experience, relating it to certain examples that you've had about the relationship between health and housing?
Okay, so the first thing is to innovate, and of course, the simple arrangement is developers who have housing with good spacing should use that as marketing strategy.
Okay.
So we will say, oh, this is how I'm building, this is the space available, and of course, individuals can take their decision based on that space. Now, families, you also start requesting for certain things within a building before they either rent or purchase.
Because it's their right.
It's their right.
Of course.
Now, you want a space where your children can come out and play.
Of course.
So within that neighborhood, the buildings there, do they allow space for children to play? If they are not allowed, all that you need to do is that if you avoid such places, 2 years the developer won't have money because nobody will patronize the person.
So in essence, what you're trying to say is that whenever someone wants to rent an apartment, especially a family setting, they should be very keen about the kind of environment.
Yes.
So what if they don't have elsewhere to go to, or they don't have another solution and they are just stuck at that moment? What do they do?
The whole issue around housing is, in addition to the building, there's behavior change.
Okay.
So once you accept a certain behavior, the market will follow that behavior.
Okay.
If, for instance, majority of us decide that, look, you know what, moving forward, I will only rent a house if there is space for this. Oh, if we're going to have a place, by the time people start thinking that, look, if I don't put this in place, I won't get the market. Then you don't need to force anybody, because everybody's looking for space for market.
For market.
So the guys who are doing the right thing will get the market share. Do you understand? And we're talking about smart homes now. When people say, okay, fine, if there's solar in a building, it means that you've addressed the issue of power.
Yeah, of course.
I know that power supply is critical to human existence.
Okay,
power supply is critical to health. So a building that has a solar system will definitely be priced different from a building that doesn't have a solar system. So if you now say, oh, people are patronizing this individual, those who have not put that in place will now start thinking of putting that in place. So the same thing, if people start saying, I must have this space before I purchase a building, or if the kitchen has to be like this, because kitchen is also important.
Of course.
So if the kitchen is not spacious enough for cooking and of course ventilation and other things that relate with these things, then by the time you do that 1 to 2 years, people will now change. You see, the thing is, once things are linked to finance or to profit and what, it's difficult to change. That's why government put in policies, but it's difficult to enforce those policies because people are making profit for those options. By the time people are start patronizing the options they have defined, these people will have no option because they will be demarcated by natural forces, and they will now do the right thing for people to improve.
Interesting, really. So, what about the existing places like this that they're already in existence? Are you trying to say that they should demolish them and get us a new infrastructure, or how do we do about the already existing ones?
So remember that the discussion is housing ahead.
Of course.
And I won't want to go into the areas that are not related to that. But let me tell you, each time you demolish a building, it affects the entire family.
Indeed.
So the starting point is prevention.
Okay.
From day one, let's look at how we can prevent housing that are substandard, housing that are overcrowded, whether it's in slums or in urban settings, and houses that meet the standard that people can use that encourage their mental well-being and, of course, their physical
well-being as well. All right, that is it, and we'll be going on a very short break. When we come back, we'll be wrapping up the program. Please stay tuned.
Visit Housing TV Africa on YouTube and click on the subscribe button. Subscribe to Housing TV Africa to stay updated on latest happenings in Nigeria's housing sector. Follow our social media pages, like and share our posts. On Facebook, Housing TV Africa. On Twitter, Housing TV Africa. Instagram, Housing TV Africa.
Welcome back. This is Inside the Real Estate on Housing TV Africa. I am your host, Hafsat Oreme Ibrahim, and I'm here with a guest, Dr. Terfa Kene, and he has given us a lot of insights, education, and enlightenment about housing and health, the correlation, the relationship, and the way forward in that aspect. So I would like to ask the final question. And the final question is, you should tell us how many years of experience you've had in your profession, and by extension, give us the basic insights, the advice on going forward, how we can be very keen about our health, how to take our health seriously in the housing sector.
Okay, thank you very much. So I graduated from Ahmadu Bello University Zaria in 1998.
Okay, nice.
So 1998 to now, that is 28 years.
Yeah.
I've been a public health physician, consultant public health physician since 2007. And of course, I was last year elected as the President Association of Public Health Physicians.
Congratulations.
Which comprise of doctors in the university, public health physicians, who are consultant public health physicians and public health experts in the university, in government institutions, in the NGO. We are over 3,000 members across Nigeria. And basically, we try to provide public health advocacy, insight into things that human beings should be doing to guarantee the health of the population.
Nice. So aside from that, like, how can you tell us some of your success story related to this?
Oh, okay. So
yeah, highlight them.
Of course, we've been here for a while now. If I've seen any surveillance program executed, it's public health physicians behind it.
Wow.
Yes, we are talking from Ebola Ebola trials, Ebola response. Public health physicians involved in surveillance systems, epidemiologists. I'm an epidemiologist, so we look at disease control with respect to the context in which people live and work, and housing is part of that. So we look at these things, and we record a lot of results.
Nice. So try to give us your final word on the general topic, and let's end the program for today.
Okay, so thank you very much. Abuja is developing. We're seeing new buildings every day. But my final word is simple. Let's not move from crowded slums to crowded duplexes. We should have space for individuals to get exposed to the sun easily. Families should get exposed to the sun, because by so doing, the sun gives them free opportunity to produce vitamin D, which help them with cardiovascular health, reproductive health, and mental health. So it's important that we should provide space within the housing arrangement of Abuja. Thank you very much.
Yeah. So thank you, and we are really excited to have you on the program. That's the much we can take on this week's edition of Inside the Real Estate. Remember, I wasn't alone in the studio. I was with Dr. Terfa Kene, who gave us insight, enlightenment, and solutions to housing and health issues related and the correlation. So with this, we'll draw the curtains on this week's edition of the program. And he made a very valid point, which I held on to. He said that we should not move from crowded slums to crowded estates. Please do well to join us next week on the same program. I still remain your anchor, Hafsat Oreme Ibrahim. Thanks and bye.